It has come to 56 now.
Shubhagato, you want to start?
I was waiting for 75 magic. All right. Good morning, good afternoon, good evening from wherever you're joining this webinar today. Thank you so much for being with us today. We at the Center for Policy Research and the Scaling City Institutions for India program are delighted to be partnering with the Regional Center for Sanitation in Sri Lanka for Saxena, Lumanti support group for shelter, UNICEF India, WaterAid Bangladesh, and our alliance called the National Fecal Sludge and Septage Management Alliance, which is a network of 30 organizations that have been very active in the fecal sludge and septage management sector in India. Today we are looking at informal settlements and COVID-19 with a focus on water and sanitation as a frontline response. We are delighted to do this at the South Asia level and to compare and contrast different efforts that are coming off from the various sites that our panelists are working on. At this crisis, given that the communication is of a completely different nature, and that simultaneously we need to learn from each other quicker, this is an opportunity to do that. We look forward to questions. Please write your questions in the Q&A section. We will try and pick that up at the end of the presentations from the panelists. I'll just share my screen and take you through as an introduction to today's event. Yeah. So informal settlements have been in our minds during the COVID-19 pandemic. And of course, given that we all work in water and sanitation, what happens to people, how are governments responding, how are communities responding, and what lessons we can learn from the countries in South Asia. More generally, South Asia remains one of the weaker regions in the world in water and sanitation. And in this crisis, we want to learn lessons quickly for adopting them in our own work and in the work that we help governments with. Yeah. So in general, South Asia's numbers are reaching around the 1/3 of the global level. The 4 countries today, India is the only country where the cases still are on the rise. Bangladesh had reached a peak 2-3 weeks back. The more recent data is showing that the per day cases are coming down. Nepal and Sri Lanka have remained quite less affected by it, though there are spikes in between. So means while this is the context of the 4 countries that we're talking about, apologies. Apologies. Something got, yeah. Can you see my screen?
Yes, yes.
Yeah, okay, great. So, and as I was saying, in most of these countries, there's been a lot of coverage around what happens in informal settlements and flagging it to become one of the critical issues around the response to COVID-19 in our countries. There's been press clippings from across the region talking about it. Given that we entered the COVID-19 scenario with so many inequalities and with limited control on what we are doing in terms of water and sanitation in these highly dense settlements, which are on the edge of formality because government programs, government services are quite precarious here, and the connections between government and these settlements are not like elsewhere in the city. These locations, however, are quite significant across most of our countries in terms of the services penetration. And there will be, yeah.
Sorry to interject. We can't see your screen, Shubhagato.
All right. Let me try again, else I will just walk you through it.
Yeah.
There seems to be,
Yes, yes, now we can see.
Okay. Um, uh,
Still on.
is this visible now?
Yes,
Yes,
yes, it
now
is.
it is
It
on the
is.
screen. Yes.
Thank you. Yeah.
Thanks. So, and you know, we've had various zootonic disease crises in the recent past in our active memory, but none has been at this scale, of course. But learning from Ebola and the literature that came out of Liberia and West Africa at that time, there were some experiences that could be looked at and has kind of informed the crisis management so far. In some of these informal settlements, of course, food distribution is something governments have taken up quite actively. The case of Dharavi, which is the precursor in terms of how strategies for informal settlements might be built, is informing new strategies too in different states. The active trace, test, track, treat effort in Dharavi was led to some pretty good results, and the crisis was contained to an extent, at least for now. But in the Ebola crisis too, in informal settlements, the way governments and communities work together, they also put together quarantine and isolation centers within slums. Just by community's own efforts, they identified schools or common facilities where people from these whoever were feeling unwell could be isolated. We could look towards that strategy too. On emergency wash and improving service levels, that's a frontline response. So far, much of the work has been around using current facilities and ensuring some sort of additional emergency measures and social distancing. But in the medium term, given that this crisis is nowhere near over, it is an opportunity to push for much more improved service levels in these settlements. And finally, the lesser discussed and the lesser understood aspect of working in informal settlements is the issue around livelihoods and outmigration. So in Dharavi, it came out quite strongly that when these settlements were closed down, lots of outmigration happened from there. And of course, the livelihoods of the poor living in these settlements have been on threat. And so getting services has been quite difficult. So just with that background, I want to introduce the speakers in one go, and then I will request them to come in one after the other. So we are going to start with Ms. Hasin Jahan, Country Director of WaterAid Bangladesh, who is a stalwart in the sector, has worked with many organizations in the sector, including with the local government department, and in her last post was the country director for practical action in Bangladesh. After that, we will hear from Lajana Manandhar, who is executive director of Lumanti Support Group for Shelter in Nepal, who has been doing a lot of interesting work with the organization for the last 18 years on providing access to housing and basic services in lower income settlements. Next, we will have Mr. Ananda Jayaweera, who is the technical advisor to the government in Sri Lanka on integrated water resource management, and an advisor to the regional center for Saxena. We then will have Maria Broekhuijsen and Shipra Saxena from WaterAid, from UNICEF India, apologies. And while Maria looks at the urban water sector at the national level, Shipra has been championing urban wash within UNICEF India very strongly and is based out of Bhubaneswar. After that, we'll have a brief presentation from my colleagues Anindita and Neha. Anindita Mukherjee has worked in the sector for 17 years and has worked in a range of issues from water sanitation to housing to planning at different levels of government. Neha is an engineer from in the IIT and has been doing a lot of technical work on issues related to fecal sludge management, but water and sanitation more generally. Finally, from at the global scale, we'll have Roshan Shrestha, Deputy Director of the Bill and Melinda Gates Foundation. Roshan is very well known in the region. He has held over the last 30 years very many important positions, including at UN Habitat. He currently runs a number of very interesting programs in the region and will give us a perspective of the global scale and issues of South Asia in the global context. Finally, the agenda is structured in two parts, but we will take questions at the end of all the presentations. The first part, we are hoping to hear more about community responses. And then we also want to hear of what development partners have been doing with national governments. And then Roshan will be a discussant. And after that, we will come to the Q&A session. With these opening remarks, I'd like to request Madam Hasin Jahan to please come in. Would you be sharing your screen, Hasin?
Yes, thank you.
Yes, we see your screen.
That's great. Let me put it into slide show mode. Thank you, everyone. Welcome to my presentation. In fact, in Bangladesh, 1/3 of the total population of Bangladesh lives in urban area, and more than 30% population of the major cities live in slums and low-income communities. So you can imagine the density of urban population, especially in slum areas in Bangladesh. Over 100,000 population live in Korail slum alone. So I think this is the largest slum in Bangladesh. Slum dwellers makes up an essential segment of the urban labor force in our country, but yet they are the most vulnerable population. Why they are the most vulnerable population? One of the reasons that they are sharing common water and sanitation facilities in the slum areas. And people living in slums, they are living in a very congested place and often living in one room, 5 to 7 people, they are living in one single room. And now we are talking about social distancing, and which is nearly impossible in any slum area. And when we are talking about the support extended by the government or other NGOs in the slum areas, those are really very limited. And mostly those are limited to relief distribution in most of the cases, and by the government, and limited to food only. And very, sometimes the philanthropies and individuals and NGOs are coming up with support and mostly related to food. And in many cases, we are seeing they're coming up with 1 or 2 slums or 2 soaps for each of the families. And those are very limited support. And all of us know that hygiene is the first defense against COVID. But yet the slums are lacking support in terms of having adequate wash facilities, wash means water supply, sanitation facilities to fight against COVID-19. So this is the scenario in the slums. Moderator is supporting more than 500,000 population in 150 slums in 4 cities and 3 municipalities or small towns in Bangladesh. But still, the compared to the requirement, this number of population is very tiny, to be honest. We are providing context-specific hand washing stations at the entry point of slums and strategic and convenient locations. And those context-specific hand washing devices are child-friendly, disabled-friendly, and we are trying to make it accessible for all segment of the population. We are distributing hygiene kits and regularly disinfecting wash facilities and ensuring environmental cleanliness and disinfection and kind of sensitizing the slum population for disinfection of the entire slum. And most importantly, we designed and disseminated context-specific awareness materials and communication materials so that they understand what to do and how to do, which is merely absent in our country. And we oriented the sanitation and waste workers who are living in the slums and how to manage their work and providing them with the safety gears. So these are the things we are doing at slums. Until now, as Shubhagato was showing us in his first slide, that what is the situation in Bangladesh, that the total number of cases is over 200,000. And though the peak is showing going to downward, but still there is a confusion because the number of tests is already reduced though. So the number of tests has been reduced as well as the number of cases has reduced. So there is a correlation. It doesn't mean that the peak is really going down. So we are still in confusion that whether the peak is really going down. But the sad part is that we don't have any segregated data on the slum dwellers. So we cannot say that how many people are getting infected in slums in particular. So there is a missing link. So if the people in slums get infected, then we are in a greater danger. City dwellers will be in a greater danger because the slum dwellers are the lifeline of the city. So there is a great danger. So considering this, what RAID is piloting a mobile-based application for early detection of the potential cases and management of those cases through community engagement. And through this COVID-19 tracker application will help collecting the data for the slum dwellers for surveillance of the health condition of the slum dwellers, for early detection of their cases and linking them with the with the testing services and quarantine them well ahead so that we can save the rest of the slum populations. So that is the main objective of introducing this tool. And very recently, the government of Bangladesh announced a competition on software development, and this mobile-based application actually won a special award award and under the special category of software solution. And we are having a partnership with several entities with this application, and especially A2I, Aspire to Innovation, one of the government project. They will be hosting this application in their system, so that the government will be basically hosting this application. And the Institute of Epidemiology, Disease Control and Research, in short, IDCR, they will be extending us support for testing the slum dwellers. So that is the agreement we have recently signed with them. Apart from that, NUPRP, that is one of the big projects of UNDP and Bangladesh government, they have agreed to roll out this application and community management to support the slum dwellers as well as SPRAG. They will also roll out this in their own program areas. And WaterAid will be also rolling out in its own program area with support from SDC and CIDA. So let me explain how this whole system will be managed through community management. Because this is basically a tool for identifying or detecting the potential cases. So that's all. The entire process will be managed by community engagement. A community response team will be formed in a slum, taking from youth, women, and people from the slum, and they will be basically managing the application. And this application will be used for screening the people by using simple question answers, and they will be identifying that who are under high risk category. So the people who will be identified as high risk category, so they will be connected with the government mechanism, and the doctor will be talking to them and try to identify that who are the potential cases, and the potential cases will be advised to get tested. And as I said, that IDCR, they will be extended support for testing them. So once they are identified as positive, then they will be taken to the isolation. And the existing community spaces within the slums will be converted into the isolation center. And in our pilot slum, we have already arranged that there is learning centers within the community slum areas. So we are converting the learning centers into isolation center.
Mr. Han, sorry, we are 9 minutes into the presentation. We have 1 more minute to go.
Yes, I will finish by then. And we are converting that into isolation centers with adequate water and sanitation facilities. And the CRTs will be sensitize the communities and help them to maintain the isolation properly. And they will support the isolated isolated patients as well as the family. And the critical patients will be supported as well. And not that everybody will be isolated. So some people will be also remain in quarantine within their household. So that CRT will be extending support to them as well. So there is a huge potential of this application, and this application can serve as the platform of plasma bank. You know that the demand of plasma is coming up very acutely nowadays. And not only that, government is planning for isolating zone and lockdown. So we are also trying to link this with that platform as well. After successful of this pilot, as I mentioned, that BRAC and UNIPRP project, they will also be rolling out that. And most importantly, the learning of this will be documented properly and disseminated widely. So that's all from my end, and thank you very much for your patience here.
Thank you very much, Ms. Hasin. This was very exciting. I guess there's been a lot of discussion, and this seems to be showing us how it gets implemented and what the connections of all of the use of technology to bridge this gap between what government wants to provide and what people actually need. It's a very interesting example. Of course, it does open up a whole set of new regulatory concerns and support concerns, and you showed us a great example of how it will benefit the community and the city more widely with the plasma bank too. I wish you all success with it. I would like to now call on Lajana Manandhar to kindly make her 10-minute talk, please.
Thank you.
Will you be presenting?
Yes, yes. Okay, do you see my slides?
Yes,
No, no, not yet, Lajana. Neha, is this your computer? Or this is Lajana's computer? Okay. Yes, yes. We
See it, yeah.
Yeah?
Lajana. Yes.
Yeah, you
Yes.
see it, right? Okay, okay, let me start. Okay. Okay, thank you for giving me this opportunity to share some of my feelings and also learning as well. I'm going to be very brief, and I actually thought that I will not speak more on the smaller part of, like, smaller kind of like part of what is happening, because I think in the last few months since the lockdown began, there's been a lot of talk on WASH as well, in relation to COVID and what is happening also in the poor communities, including the situation in the informal settlements, right? So basically, I'm going to speak briefly about the status of informal settlements in Nepal, WASH situation in the informal settlements, the crisis itself, and the quick survival actions, and how can we actually learn from our past practices so that people can stay safe and also live a dignified life, especially the informal settlers, the slum dwellers. Talking about the informal settlements, the status of informal settlements in Nepal, we have recently formed the Land Issue Resolving Commission, which is formed very recently, and that actually estimates nearly about 6 lakh families live in the informal settlements. So 6 lakh families live in the informal settlements. And also there is an estimation that in the last 3 decades, 46,000 plus biga, more than 46,000 biga of land has been distributed to the landless families, to the landless people. So that means like 1 biga is about 1,333 square meter, right? So that this has been continuing, and also the recently formed Land Issue Resolving Commission is also working on planning to distribute the land to the genuine landless families. That's their plan. Okay. But then, still then, for the last 3 decades, this has been going on, right? But the issues of the informal settlements still exist. The issues of the slums still exist, and the issues remain the same. The informal settlements still exist. So where did this land go? Who actually got it? What had actually happened in the name of the poor families? So that is a big issue. That's a big challenge. And okay,
can I just request you to put your slides on full screen? Just on the bottom left, there's the projection below that. Yeah, on the left of your screen. No. Yeah, normal view and then left of it. Yep.
Can see it, right?
Yeah, right where your cursor is, I guess.
No, this is something is hiding it. Okay, I got it.
No worries. Sorry, it's just that the slide moved to the side. It's quite visible. Otherwise, please carry on. It's so little smaller. Yeah, that's fine. That's fine. Thank you. Yeah.
Okay, so the situation in the informal settlements, people have been struggling for their identity, for decent life, and to achieve their rights, which has always been violated, living in the slums. Like human right is abused, housing right is abused, wash right is abused, and the people still continue to struggle to achieve their rights. This is the situation in, I think, in almost all the informal settlements. No adequate, because of all these problems, no adequate investment has ever been made to improve living conditions, including wash facilities. To improve the wash facilities, no adequate investment ever has been made. It's like smaller investment they make, right? Smaller kind of like investment, smaller planning, smaller kind of actions, but then it's also not including in all the slums in the countries. If you have a plan in certain areas, you just work in that certain areas, you do a smaller project, but then the rest of the settlements are avoided, no actions, no work is ever been done there. So that is, it should not be the way it's been going on. Critical wash issues in the settlements are, we know that what are the critical wash issues, like the issues in relations to quantity, frequency, quality, fecal sludge management, connections problem, affordability issues, and also the behavior, attitude, behavior, and many more, menstrual hygiene in relation to women's wash issues. There are all the critical wash issues that exist in the settlements, in the informal settlements, and people have to live with that. They have been living with that. They still have to maybe live with this for such a longer period of time until this is addressed properly. So COVID exposed the health risks accumulated in the informal settlements. Now the COVID happened, this pandemic happened, and now we see what is actually lacking in the informal settlements, what is actually not happening, what are the people, how the people are suffering without having a basic access to all these very important facilities. What is the life there, how they are living it, what are the problems. So the COVID actually made all this accumulated risk in the settlements, it exposed all, and now we are actually seeing it. We also know that beforehand, but then although we know that, although the government, the policy makers, the duty bearers know that, but they have just been closing their eyes. They have shut down their eyes and they don't want to see it. They don't want to realize the issues or not even to think about it seriously. So now it's all it's all seen now. So whether we like it or not, in future, we have to deal with the seriousness, all these issues to get to find a permanent solution to all these issues. Otherwise, this will be just keep on going. We, in the last month, in May, actually, we conducted focus group discussions in 30 urban poor communities in Kathmandu and also in the eastern and western parts of Nepal to learn about the immediate impact of COVID. So how people are reacting to it, how people are coping it, how they are adjusting with the new changes that they have to follow, that they have to live, and also the poor communities, how they are coping with it. So we talked to the people through Zoom actually. So the community leaders came to the Zoom and then we talked about it. So what we found is that the main issues for the people are loss of income. They have lost their income because it's lockdown. They can't go for work. Everything is closed, shut down. So they lost their income. The hunger is prevailing. But the key issue is how to survive, how to get 2 square meals a day. And the future is uncertain. So they're worried about the uncertainty of future. The earlier demand to the government was also to provide adequate supply of food relief. So the demand was food relief, and the government and also the other agencies also got busy in distributing relief food package to the people. These issues seem to have dominated wash issues. So that's the concern. So everybody, the people actually talk seriously about all these issues, although the wash issue is very pertaining, but they did not mention it with such a high, giving such a high focus on that. They just talked about the hunger, loss of livelihood, loss of income, but the wash seems to be dominated. All these wash issues seems to have been dominated by all these issues. But then,
ma'am, sorry, we are 8 minutes into the presentation.
Okay, and the key issue seems to be actually that came out in the discussion is purchasing. People have to purchase water, and purchasing water during lockdown had posed a dilemma to the poor, mostly in the urban communities, whether to buy food or water, which one to consume less, food or water. Dilemma during a period of shortage had given the mental stress to the people. People spoke that the only thing remaining is to go insane now. There's nothing else. A desperate kind of situation is there. So there is a need to how to unveil the wash issues in this pandemic. So what actions were taken? Like Hasin, Jahan also spoke about, it's not the different here is happening in Nepal. So almost like maybe in India and Bangladesh, also Sri Lanka, the same kind of relief packages that's been provided to the informal settlers, to the slum dwellers, food relief package distributed along with a bar of soap, hand washing station installed and water purchased in few urban communities. Public space was sprayed with disinfectants, PPE is provided to the sanitation workers. So all these kind of support actions were actually taken. So some support is provided to the people. Community groups supported local governments in establishing local quarantine centers, identifying the people who have returned from abroad, right? And helping them to go for testing and also put them in isolation, quarantine. So that's all is happening, and people are actually working with the local governments. The local women managed saving and credit cooperatives, also providing a loan to interest-free loan to the members to meet their food, wash, health, and livelihood needs. So these are the quick survival actions taken to cope with the COVID crisis in the communities. But then in the past, so what has actually happened in the past is ODF drive resulted in the construction of private toilets and promotion of hand washing practice. Nepal was declared ODF on 30th September 2019. So in the process of declaring ODF, lot of activities had actually happened, and then including in the informal settlements also, people were supported to build private toilets. So majority of the people in the informal settlements have access to private toilets. Also, although it is a very basic kind of facility, but then they do have access to toilets. It need to be upgraded. That is a different thing. But very, very few families are sharing the toilets, right? So because of this also now, I think it's the sanitation part, the toilet part, access to toilet is much better in the settlements. And that has also reduced the stress on this part, I think. The communities are organized. In some communities, the organized communities have actually installed water storage tanks in the poor communities. So this has been a great relief. Now you need water, you buy water, but then where you put the water? So at least there is the facilities existing now. So the supporters, the donors, even the governments or even the communities can purchase water, bring water and store water when there is a big need. Access to pipe water supply, irrespective of tenure status, actually has happened in some of the slum communities. That has been a great relief. Provision of easy loan to improve wash facilities actually has contributed in building resilience of the people. So that has been a great relief. That has actually eased the stress from the pandemic. Otherwise, it would have been much more worse scenario. Decentralized water supply system in the informal settlements also contributed in the number, also positively contributed, also help people in the number of settlements where this kind of projects has actually happened. Integrating WASH with secured and permanent housing schemes has actually taken place in quite a few communities in quite a few cities. And this is the example of like addressing the issues permanently, issues of the informal settlements, and availability of waste materials in the stockpiles for use during the emergency period also actually helped in addressing the issues on time. So these are the actions that has been happened before as a part of preparation or even as a part of making contribution in improving the living condition of the people. Because of this thing has happened, so the issue actually did not kind of like blow up hugely, I think, at this time of pandemic. So my recommendation would be, there is no database, as was also talked by the previous presenter. We need to have a proper database, but then just having a database, just having a figure, it is of no importance. We have to make it live. We have to see these data, these figures, these numbers are human faces, the poor people, the vulnerable people living in the informal settlement. So we have to talk to this data. We have to make it live and we have to respect the rights. We have to show seriousness to address the issues of the informal settlements. We have to make and implement a city-wide investment plan, a short-term and long-term, and promote a practice of good governance. That is very, very key, a practice of good governance. And also, we have to learn to work in partnership with the communities and also build strong monitoring mechanisms to make it a success, or sustain the success. So this is very important. And then it's very important to realize that patchwork will not give dignity and sustained protection to the vulnerable people. Neither ensures safer and healthy environment for all the citizens. So this is an important COVID lessons, I think. If we don't address the issues, if we don't address the WASH, livelihood, housing, and other issues in the informal settlement of the people living there, we all will get affected by this. So this is an important COVID lesson. So we need to close the gap now. This is the only time. Thank you very much.
Perfect. Thank you so much, Lajana. I thought you brought out so succinctly the issue that if you are better prepared in going into the situation, there are benefits to it. I'd like now to request Ananda, Jayaweera from Sri Lanka to make his presentation. I guess, Pooja, you will put on the presentation and Ananda will talk to it. It's interesting how Lajana mentioned that this is informal settlements being seen as reaching the unreached. And Sri Lanka, in one sense, in the South Asia region, has had its water and sanitation infrastructure in place for a little longer, and at higher qualities of service levels. So we're keen to hear from you, Ananda.
Good morning, everyone, and greetings from Sri Lanka. I hope you will put my presentation.
Pooja, Neha, either of you will put on the presentation, please.
And in the bigger picture in Sri Lanka is that we have contained successfully, especially the community spread. On the first slide, give you the snapshot of up-to-date status. So our health sector is very strong, and they have done a marvelous job in containment. And they all tracked down everybody, and in March, the first case was found in March. It was actually from a tourist guide contracted the disease from tourists from Italy. So after that, swift action was taken to close the airport and impose curfew for 52 days. And the next slide. Next slide. Impact of COVID on informal settlement. I think, sorry, previous slide, the second slide. Is it Sri Lanka being an island? Oh, it's jumping the slides. Second slide. Sorry.
Neha, I'll just reshare it. There was a little bit of an issue in forwarding the slides, even at my end. I felt that today.
Yeah, Sri Lanka, being an island, had to plug the influx of visitors. Actually, persons arriving was sent to quarantine. Community spread was prevented. And we have very strong legal framework, Prevention of Disease Ordinance, Act number 12 of 1952. Then closed the only international airport, and as I said, imposed 52-day lockdown style curfew, tracked down associates, isolated, and quarantined. I think pandemic law enforcement 14,000 self-quarantine. Banned festival, public and private gatherings. The clusters were handled decisively to contain community spread at peripheries. Now, especially these urban settlements were isolated, and they are surrounded by streets of Colombo. So they are actually close communities. And it was easy for authorities to arrest the spread of the disease at the peripheries. Next slide. Yeah, WASH interventions prior to COVID-19 by two major projects were responsible for successful containment of the disease actually. It was called community mobilization and behavior change in urban low income settlements in Colombo. That the intervention actually promoted community solution in upgrading living standards and accessibility to service through reach in the unreached project for improved health and nutrition. Distributed emergency items, personal protection equipment, and for hygiene, PPE for hygiene. Importance of nutrition and immune response. That was also part of the awareness carried out by under these projects. Next slides. I think the prior to the intervention, community perception was this. They actually understood what they are missing. Lack of sanitation and shared toilets, shared water points and bathing places. Before the intervention, the water was given through stand posts, and there were a lot of losses to the utility provider. Then inadequate toilet facilities, poor maintenance toilets, low water pressure during daytime. Outsiders also use these stand pipes to wash cars and things like that. Then the community were affected due to various reasons. So next slide. So wash promotion to improve access to formal services of the government from 2016 to 2020. That was the time period the service levels were improved. Then individual household facilities with metered water connections were provided. There was a special schools program, fill gap to implement post-COVID-19. School restart guidelines were prepared and issued by the Ministry of Education. Then these low-income settlements, people were taken on field visits to major water treatment plants and wastewater treatment plants to show them how they get water and what type of cost involved, and they were actually educated on the type of infrastructure that is supplying water and storage services. So the main aim was to create a conscious water and health conscious community. Then household water conservation was promoted, and the burden on the public utility was eased through timely payment of bills and was reduced non-revenue water. Personal protective gear distributed with wash consumables. There was a EU grant to reach in the Unreached project to give face masks and foot-operated hand hygiene kits and hand washing facilities. Next slide. Then schools, I think these are the things to be introduced when the schools started. Schools will be starting by, I think, in September. And it is a task is to introduce additional hand washing facilities and also aware the people and students on the hygiene practices and the critical hand washing times. There are more critical hand washing time than before. Now it is as soon as they come to the classroom, they have to wash hand, and they before meals, after meals, as well as when they go home, another time they have to wash. Something like that we have been introducing. Next slide. These are the pictures of the low-income settlements where the programs were conducted and demonstrated on the hand hygiene aspects. Next slide. There was another slide.
Yeah, I guess there was another picture, Ananda, but I guess
yeah, that I think actually this program was extended in the plantation sector where there is a very congested type of accommodation is provided for the plantation workers. Somehow there were not a single case in this plantation sector because of these actions by the health authorities, the military and the government, and also the local level, the NGOs and government sector health authorities. Thank you very much. I think I have saved some time.
Yeah, thanks, Ananda. Means it kind of demonstrates that in continuation with Lajana's intervention, that if a lot of the conditions are improved before, the resilience of the communities, to at least water and sanitation is stronger. Means you did mention about the costs for water as in Nepal if when livelihoods are at risk, and how in Sri Lanka also kind of demonstrates that how similar standards can be across put across to all schools, all institutions, without necessarily having too much additional effort for informal settlements, and that goes on to demonstrate that's a long history of stronger.
In fact, the government, one more comment I need to make here, the government policy is to resettle these people and reclaim, use those lands for better commercial activities. So these people were given high-rise buildings actually as housing.
Sure. Okay. Thanks so much, Ananda. We should move on. Maria, I guess you're going first, and then Shipra after you, right? Will you be sharing your screen?
Hi, good morning, everyone. Yes, I'll go first, and I will share my screen. But you would have to stop sharing yours. Yeah. Okay. If you cannot hear, if you cannot see, please let me know. Otherwise, I'm just going to continue. Okay. So I would like to share some more information on the situation in India, mainly from the national perspective. I'll try and highlight some of the things specifically we've done in Maharashtra, which is one of the states in India and currently the state that has the highest caseload of COVID-19 cases, and where also Dharavi, the slum that we spoke about earlier is located. Dharavi is part of Mumbai. Mumbai is the capital of Maharashtra. So just a bit of background. Currently, there's 1.2 million cases, COVID cases in India, both active and recovered. But what we see is that most of the cases, or many of the cases, are concentrated in urban areas, and also many of them are in urban sprawls, informal settlements, slum areas, etc. And what we say here is that COVID-19 really is an urban disease. It's concentrated in a few cities in the country. So while we have 1.3 billion population and 1.2 million cases, these cases are really concentrated in certain hotspots. And again, with slum areas being the hotspots within the hotspots. And imagine around 1/3 of India's population, according to the census, lives in urban areas. And out of that, almost 30% of the urban population lives in slums. And if you look at a city like Mumbai, even up more than 50% of the population lives in slums. So slums, of course, I think earlier speakers already spoke about this. There's major risk factors for people living in these areas: higher transmissibility, higher prevalence, higher case fatality, and higher vulnerability also to other disasters and hazards. So I won't go more into detail. I think we are familiar with the background. Just to flag that the situation of accessing wash facilities and services in slums is also a challenge, just like the other countries in the region that we've heard from. Also in India, this is a challenge. Mainly in terms of accessing piped water throughout the day, or piped water inside within the premise. Those are really the big challenges. So similarly, having a latrine inside the house or within the premise is an issue. So people either need to use a community toilet, or they would have to go out in the open. And then also wastewater outlets are not necessarily connected to a closed drainage. Either they will go out on the street or they go out in the open. So all this creates wash facilities in areas that actually bring people together. While we try and tell people to physically distance from each other, do not go out of the house, they're forced to go out of the house to collect the water, to use the bathroom, etc. So what is UNICEF doing about this? What are we trying to do in terms of COVID preparedness and prevention? So apart from water, sanitation, hygiene, we also have other teams looking at risk communication and community engagement, health, nutrition, education, etc. But I'll tell you a little bit more about WASH, water and sanitation, hygiene. So initially, our regular development work was only in a few cities in Mumbai, and in Surat, in Gujarat, and in Orissa, Bhubaneswar. But we saw the need to quickly expand the work to 13 states. And we've tried to focus on the most vulnerable women and children that are living in informal settlements. So the other thing we noticed is that it's very important to collaborate with others. So for that, we have to work very closely with the health teams. We have to work very closely with the risk communication teams. We have to work with the municipal corporation, but also with the ward councillors who are working more at the lower levels. And I think it's very interesting to see how we are trying to balance a mix of the strategic technical assistance at state level, where we, for example, try and train all the ULBs on a certain topic, and then at the same time deep dive into a certain part of a slum or in one slum and contextualize the support that is required in that location, because the slums are not the same across the state, they are not the same across the country. So that contextualized support is very critical to really make a difference. We have, I think in this health emergency, in this health response, it's very important to work closely with the health colleagues. Even if we focus on WASH, they often don't, and they often forget water is important for hand washing. They just assume it's there. So I think it's important that we collaborate. So we have developed a few guidance, training materials, SOPs, but also a joint advocacy note and a preparedness and response plan for COVID-19 in urban settlements, together with WHO. And this is also shared with Ministry of Health and Family Welfare. So these are good resource materials that can also potentially be used by others and even other countries. And there's a link where you could find out more. I will not go through all the detail. I would really want to give Shipra, my colleague who is working on the ground in Orissa, more time. But just to highlight 2-3 issues from this slide and the next slide, so you have an idea of all the different type of work that we are doing in these 13 states. For example, it's important to understand the situation. I mentioned not every slum is the same, so we need to understand the situation. What is the WASH access? Where are the cases? Where do the people live? And how can we support? A very interesting secondary data analysis that was done in Gujarat, in Ahmedabad, in one of the most affected cities. We saw that when we looked at the caseload, the slum density and access to WASH, we actually saw there was a linkage between those. So the highest number of cases were in the area of the city that has the highest population density in living in slums and with the least access to WASH. So it was very clear that the focus should be on these areas. So we do not necessarily have to focus on the whole city. We can concentrate on these hotspots. And then when we use that information to understand what is the situation, where to focus, government in India is developing something like a containment plan. So whenever we conduct a micro planning for a certain slum, we should make sure it's aligned with these containment plans, and then governments are owners and feel ownership of these plans. So I think that's very important in that area. And then also capacity development. I think there are so many new things and continuous new information that we are still finding out about this disease. So information keeps on evolving, and it's very important that while we continue to provide access to water and sanitation, we do ensure that the wash service providers are safe, and they can do that in a safe way. For example, a community toilet operator and a sanitation worker, a waste picker, what protective equipment do they need, and how would they use that? What happens to the biomedical waste? The waste from households that have active COVID cases, or waste from containment zones. So developing guidelines and training government staff at the state level, at the city level, but also at the slum level, and even volunteers who would be interacting with others in the slums need to understand different types of information. We cannot do this alone, and I think it's very important that we coordinate with others. I mentioned it before, but we can also leverage. In India, there's a big business community. There's a lot of corporate social responsibility initiatives. And just to give you an example, I think we spoke already a bit about the migrants, people that are forced to move back to their homes, or that have no livelihoods and are stuck inside the slums where they were living. So how can we track them? How can we reach out to them and provide them with essential items? So an example in Maharashtra is an initiative that started by UNICEF. Is a Divan Rat, and UNICEF brought together more than 55 partners, leveraging all the different types of supplies that these migrants would need, and started to distribute these migrants. So there was hardly any funding involved. It was all collaboration between partners and corporates providing the different support. And then lastly, I think it's important that we focus on risk communication, but also in schools, in health facilities, and we ensure that the right wash facilities are there. And I've heard others already talk about the pedal-operated hands-free hand washing stations. So we've also developed a compendium of different designs and models that could be used across India, and we've kind of championed the leveraging of these, but also installing a few, and we've seen a really great uptake. I don't think we have a lot of time left. I would really like Shipra to talk more. These are just 2 slides. I don't know if slides will be shared, but these are 2 slides that are speaking a little bit more about what is happening in Maharashtra, in Dharavi, Mumbai, and in others. I think it's similar to what I had mentioned before. So it's really supporting the migrants, while they are on the move. It's about the capacity development and contextualizing the learning that is required. Focusing also on school teachers and schools that are changed into quarantine centers and shelters. So we should not forget about those. It's about assessing the situation, assessing community toilets, and training the service providers so that they are safe. And you can see some pictures here of how people are completely wrapped up, and they learn about how to protect themselves, but also how to improve the cleaning and the operation and the maintenance. So I'll keep it there, and I'll hand over to Shipra. Thank you so much.
Thanks, Maria. Shipra, 5 minutes or so. Are you showing a presentation? Shipra, you're next. Maria, it was interesting to hear this means I'm sure lots of questions will come up during the discussion. Over to you, Shipra.
Thank you, Shubhagato. I think it's a pleasure to be here today with the eminent panelists and with wide range of experience from across the countries. Maria has set the tone, but I'll just basically speak about how we are handling it in the state of Orissa. I think different experiences, UNICEF works across in 13 states, and different experiences we are seeing across different states. So I'll speak from the Orissa experience. Next slide, please. So if we just look just 1 or 2 seconds on the background, I think I'll not read out, but 17% of Orissa is urban and which lives in about 114 ULBs. This is 2011 census data, and about 1.5 million people are living in the slums, and about 0.2 million are children, which are actually a vulnerable population when you see from the COVID lens. And the interesting part is that 20% of the slum population belongs to scheduled caste, and about 12% belongs to the scheduled tribes. In addition, I think if you look at the urban and water and sanitation data, 38% have water sources within the premises, and about 48% defecate in the open. All this is census data, and a significant progress has happened since then in the water and sanitation front. So I think urban Odisha has declared itself open defecation free, and also in terms of water, Vasudha program and a lot of urban water program investment has gone into the urban program, and significant progress has already happened. Just a line of background that actually what is seen in India as well as in Odisha, there is a 2, 3, 4, 5 syndrome which is observed in terms of urban growth. Two, if we can say that India is growing at the rate of 2%, India is growing at the rate of 2%, urban is growing at the rate of 3%, mega cities is growing at the rate of 4%, and slums are growing at the rate of 5%. And probably that we will see in the 2011 census how fast urban is growing. This is a quick snapshot of saying why we should be working in the urban slums, because usually the data which is available, which shows that urban is usually good in terms of infrastructure, access, and other services. But when we break up into poor and non-poor, you can see the upper green one is for sanitation, and the yellow one is for pipe water. The urban poor condition is really poor. It is in fact worse than the rural statistics. Next slide. So as part when we looked at all the data and statistics, what we felt that what are the wash interventions that we need to do in terms of in Odisha. So these are the couple of interventions which we have taken up. One is the drink from tap. Drink from tap includes the government has already, we are doing this with housing and urban development, and our partner in this initiative is in the IRC, Netherlands, and we are basically trying to see that 24/7 water supply is ensured with quality parameters to the entire urban population, which includes the urban slums also. So this is one of the initiatives. Next one is we are also working with National Urban Health Mission on SSS, Swasth Sarvatra, how one can work at the facility level to improve the wash situations with National Urban Health Mission. Next one is rural urban. There are a lot of facilities which have come up in the urban centers, like the Odisha has been a forerunner in the fecal sludge management plants, and the waste management. The MCC and MRF has come up in the urban locations. How the neighboring urban areas could be plugged in so that there is more environment, more hygiene, and more issues can be handled holistically. And the last one is COVID response. How we have handled COVID response in the urban, and specifically looking at the urban slums. Next slide. So drink from tap, basically we are working with the housing and urban development and providing high-end technical assistance in terms of what has been the learnings of the pilot, how do we ensure quality parameters, how do we do management at the institutional level, fixing tariffs, and also looking at the communication and branding aspect of it. Next slide. But the whole important point is giving water supply 24/7 and quality parameters. This is the most important part of the drink from tap. Next is the FSN thing, which looks after, if you see the red spot in the map, which is the urban facility, this is for the Dhenkanal district, and the neighboring areas, the orange areas and the yellow areas which you see, is basically plugging in the fecal sludge or the waste grey water which is coming out and plugging in into the urban facility. This entire thing is basically will emerge as one of the entire district is planned to emerge as one of the safely managed sanitation district. So that the plan will be for the entire sanitation, but how the rural urban linkages are ensured so that it will address hygiene aspect and environmental sanitation aspect of it, which will include slums and non-slums and rural areas. Sorry,
we are almost 5 minutes into the presentation.
Sure. I'll just be very quick. This is also on the waste management, which waste moves from household from household, from village to Gram Panchayat to block to urban facility. So this is the entire chain, which also again looks at the hygiene aspect as well as the environmental aspect of it. Next slide. So in terms of COVID response, these are the key bullet items which UNICEF has invested and is doing work in the slums. If I can just move on to the next slide, I'll quickly run through what are the key aspects. Next slide. So these are a couple of master trainers which has been trained by the health team, by the WASH team, and on the PSS also, which is basically looking at infection prevention control of the frontline workers. Now the master trainers are now going and training people in 4 cities of Odisha. Next slide. So next slide, you'll see these sanitary workers are getting trained, and you can see a newspaper clipping of Bhubaneswar Municipal Corporation. Next. This is also government licensing, which we are constantly doing with the government for different aspects, whether it is for doing capacity building or whether it's putting up hand washing, minimal touch hand washing stations as per the booklet which has UNICEF has developed and is being used internationally. So we are also doing that licensing with the government. Next slide. So you can see some of the hand washing stations, foot operated hand washing stations, and the workshop where the hand washing stations are being developed and they are being put in the high risk locations and public places. Next slide. This is some of the initiatives which has been documented very closely in consultation with Housing and Urban Development Department. The solid waste management work which has been done excellently in Paradip, and the fecal sludge management thing, and how the infection prevention and how they've responded to COVID response in the Bharampur city of Ganjam district. Next slide. So basically now what we are doing is we have seen that how different aspects, COVID is affecting different aspects of it. So what we have decided is we need to look in a little deeper into the slum profiling, and data set needs to be created, and the COVID response plan needs to be developed to handle, because COVID will take a little longer time to actually, one needs to know how, one needs to be prepared, how needs to respond, and how needs to going forward how it needs to be handled. So we are with CPR, we are trying to work on a slum assessment in 3 cities, and a COVID response plan is in the process of being developed for 2 slums, so that it can, with government licensing and advocacy, it can be scaled up across the state of Odisha. In the entire process, we are always guided by the key flagship projects, and the rural-urban linkages is one of the key success mantras, because we are not trying to build in new initiatives if it is not required, because there are a lot of facilities which have come up, but the total capacities of, say, fecal sludge management may be built in for a larger capacity. So what is required is that we merge the two so that better utilization of such facilities happen. So one of them I told you about the fecal sludge management in Dhenkanal district, which we are doing with CPR, and the other one which is about solid waste management and plastic waste management, which we are doing with UNDP partnership. So that is from now. Thank you. Any questions, I'll be happy to answer.
Thank you very much, Shipra. It was very interesting to hear a state perspective, because it kind of shows the continuity of what was happening pre-COVID, and then how the programs are being adjusted, keeping the larger agenda for the future in mind. So that was very useful. I'll now like to request, we are having lots of questions coming up. We'll just need a little bit more patience to get to that. I'll request Neha and Anindita to quickly, in the next 10 minutes, just discuss what the main responses and what kinds of numbers we are seeing in linking informal settlements. What are the key questions that seem to be emerging from our research?
Thanks, Shubhagato. As we speak today, the cases in India are nearing 250,000. And as the crisis has intensified over the last couple of months, the erstwhile invisible informal settlements have emerged at the center of the discourse. In our presentation today, we have essentially 2 parts. In the first part, we'll be looking at what the data says. And in the second part, We will try to understand what the implications of this data are, how the governments at different tiers have responded, and third, what is the way forward. So starting with what we know about the spread of COVID-19 so far in India, we know that top 3 states in the country, Maharashtra, Tamil Nadu, and Delhi, have essentially accounted for a little over half of the total confirmed cases. When we look at specific districts, which you can see in the table here, although we did not have data available for Telangana, which would also list to Hyderabad being included, most of these districts are essentially city districts and are fully urbanized. However, when we start unpacking the data a little bit more to see the spread of COVID-19 across districts of varying urbanization rates, we see that although cumulatively the confirmed cases are concentrated very strongly in the highly urbanized districts, the active cases from the last couple of weeks or so have actually been spread out over districts of varying urbanization levels. Essentially, the idea here is that as the crisis has intensified over time, and despite the initial surge in cases in highly urban centers, the cases are now being spread out across the country, across districts, and it seems that the management of these cases and the management of COVID-19 in general has had better management in the more urbanized districts, where over time the active cases have actually at a similar level compared to the less urbanized districts. Now, why are we talking about slum populations? As per UN Habitat, the slum population is bound to reach 2 billion by 2030 if actions are not taken. In India, we know we have a significant slum population. And what's interesting is that the idea that even though the bigger cities have the absolute number of slum households, the proportion of slum households across different city sizes actually increases with the decrease in city size. Already we know that the SARS-CoV-2 exposure is higher in slum areas. In fact, separately, ISMR has also pointed out that slum households may be twice as likely to be infected. When we look at the access to wash services, and of course, speakers before us have pointed out how the access to different facilities varies and is generally much poorer than what non-urban poor households would face. But one thing to note here is that it's important to understand what the quality of the service provision is. For example, even though about 50% or so households, give or take, seem to have access to all of these services, from drinking water for exclusive use to availability of toilet facilities or soap or detergents, within unpacking these, we realize that the shared infrastructure is severely undersupplied. And for example, I mean, and this has been again underscored during the pandemic. As an example, in Delhi, there have been reports about 3 community complexes being shared among 50,000 people. And Dharavi, of course, the lower end is 80 people sharing a single toilet. Water supply has been constrained, and per capita water supply can be as low as 20 LPCD, which hovers around the WHO limit for minimum supply. Not only that, on the hygiene, we notice, based on the National Sample Survey data, that slum households that rely on public toilet and community toilet in cities large and small, 3/4 of them nearly do not have access to soap with water with soap and detergent. All of these different slum specifics and characteristics based on a modeling study actually lead to the fact of higher infection rates during epidemics, and show that generally social distancing interventions are not successful in these areas. With this, I'll hand over to Anandita.
Thank you, Neha. So, next slide now. So, how have we responded so far? Our national, sub-national governments and city governments have been very proactive. We all learned as it kept happening because it was new for all of us across the world. So the Ministry of Health and Family Welfare were the center of the response, and they kind of came up with the preparedness and response guidelines for COVID-19 in urban settlements, and subsequently they also came up with a specific advisory for the slum and informal settlements. There have been numerous other guidelines in terms of safe handling of waste. PCB had come out for contaminated, discharges from quarantine centers, etc. So there have been plethora of guidance that has come from national government in line with the prescriptions that keep coming from World Health Organization. Next slide, Neha. While at the state level, the focus has remained towards, as Lajana mentioned, that to supplement economic shocks that people or slum dwellers have undergone through. Some innovative listing we have done, if you see, many actually have come up with compensations and insurance covers for sanitation workers. Many states have announced substantial packages for sanitation workers, but it's too little, too late. And there have been incentives for outsourced workers for water supply, sewerage, sanitation in Telangana to actually come to work, because they were also the frontline responder for the city to function. States started expediting the PTCT, sheet toilets, constructions and installations. However, it is a little late in the day, and there is need to expedite and be more prepared as we go forward. The cities, on the other hand, have responded very dynamically, I would say, and in the cities which are better prepared, like the smart cities. If you have heard that our smart cities have many command and control centers, and there are only 100 though out of 5,000 cities that India has. So they use those command and control centers as war rooms and could respond much better. You saw in the data that the higher urbanized area districts could respond much better, and so the active cases are low. There were telemedicine, approaches to reach to the last mile. The hand washing stations were quickly installed to kind of understand how sanitization can play a huge role, and so cities went in very fast in these informal settlements. Next slide, Neha.
Ma'am, we are 8 minutes into the presentation.
Thanks, Arashi. I'll just finish this. There has been multi-sectoral collaborations. The government could have not done on its own all of this. Development partners like UNICEF, BMGF, other World Bank, etc. actually pulled their resources in. Many of the NFSSM alliance partner that Shubhagato was mentioning actually pulled together with the government to deliver many of these in very short time period. Next, Neha. So what are we trying to kind of summarize the response of India is that active cases are spread all across irrespective of urbanization, and where there are lesser cases we need to move in quickly to create resilience or have some mitigation strategy so it doesn't go the Dharavi way, because the Dharavi way was very resource heavy, and you may not be able to do that in smaller cities and remote areas. Next, Neha. So, the short-term and long-term recommendations that we see are emerging is the water sanitation in overcrowded settlements like slums and informal settlements needs to be prioritized going forward. And if we have to build resilience, WASH has to come at the center of your resilience strategy. Also at the disaster response framework strategy, not only at the relief camps, but also as a critical mitigatory factor built into the system altogether. Thank you, Shubhagato.
Thank you very much, Anindita, Neha. As this pandemic develops and takes deeper roots into our society, means there will be changes in the nature of where these epidemics are showing up most. It means as of now, reinfection into communities which perform better is very much active. So means at this point in time, it does give us certain messages, but we'll also have to continue tracking this data as things evolve, because the situation is so dynamic, and there is a fear that if it goes down to our rural and smaller cities, we will have even lesser control about it. And so what is it that we can do in preparation in terms of increasing the resilience of these communities in advance of such an eventuality, is the question I guess you all were alluring to. I'm now delighted to call on Dr. Roshan Shrestha. He will play the role of a discussant, will highlight some of the issues that he finds most interesting to follow on, and will give us a kind of global picture of how South Asia is and what the future of COVID management in nation states is going to challenge us with. So over to you, Dr. Shrestha. You want to stop sharing this? We can see Dr. Shrestha's screen then and spotlight his screen.
Thank you, Shubhagato. I'm putting a little bit different perspective on this, the COVID response, and not only talking about water and sanitation. And our colleague really gave very good highlight about how the water and sanitation issues is definitely, this is one of the critical component that we all need to address. And the way how Bangladesh, India, Nepal, Sri Lanka, I think that we all have the similar kind of problem, and the more or less governance also, more or less similar kind of nature is there. So the way how right now, whatever I'm hearing, that is more from the civil society perspective, NGO perspective, and of course one is from the UN perspective. So, but my main concern is, now this is not really a small issue. This is a global issue, global pandemic. It happened after many years. Even we never know about that. So we should not treat it as a small, like the cholera outbreak or the earthquake or the flood. This is not a way to go, because this is totally different now, because this is a world is facing challenge problem, and none of the country are really coming up with the, not none, but like the many countries also going quite good, but the several countries are not really moving properly. Like South Asian countries are very much in trouble. United States, even one of the one of the powerful countries in problem. And other hand, you can see like some countries are really moving very well. So first we need to understand why those countries which are moving very well, and why the countries which are not moving not properly. So when we talk about water and sanitation, everything comes under those issues first. And then water sanitation is still issue, but without fixing that, we can't really address water sanitation. That's why my concern is, first I really want to address that, talk about a little bit on that. Because if you see like why German and why European countries are really setting up everything, and they are very much on the right track. And some Southeast Asian countries like the Vietnam and some countries here also moving very well. And United States and the South Asian countries is not really moving well, means the way how we need to really provide leadership to the government, and the government, how they need to really take leadership and run this business by the government-led approach, that component may be a little bit lacking here. That's why we really need to now bring the government in front, because they are the one who need to really take care, because this is not really small issue, because we need money. So where the money is and how the money really can generate. And we need a lot of money, not small amount of money. And because of that, I'm actually engaged with this COVID since it started, and the foundation is engaged in different areas. Like we are also one of the donor, and trying to bring other donors together, working together, and then bring the issue at a global level. To some extent, globally, we really successful in in bringing a lot of donors together, discussing with the government, development bank, asking them to put their more resources in the for the COVID response. For example, right now, so far my understanding, more than $240 billion. Actually, if you put all together with all IFIs, $240 billion already now parked. And then if you just go to the South Asia, like only one development bank, for example, Asian Development Bank, I just saw their website 1 hour back, and they have also more or less $30 billion they put for the COVID. Out of $30 billion, $20 billion already, I think, signed with this different Southeast Asian countries. Means the money is also flowing. Money is parked. Of course, that money is even not enough, but even that money is flowing there. But how now the government can to be accountable to use that money properly? For example, I don't know how many of you know that the India government got $1.5 billion from Asian Development Bank as a loan, and that's and World Bank money there's different, but the only Asian Development Bank 1.5 billion to India got it. Bangladesh more or less 1 billion. They also got from the ADB. Nepal, I think more or less about the I think 250 million or $300 million also Nepal also got it. Means like the money is coming there, but where the money is going? So that we need to really understand. How much money really allocated for the WASH sector? The way how normally, when I was also one of the civil society member, we always look at this WASH account, right? So now also we need to check out the WASH account for the COVID. Otherwise, where the money is going is because the bank is putting their resources in very good intention. For example, they put that money for the to address the health service improvement, to address to support to the poorest of poor people, like what we are talking about right now, how to improve the economic status, and to address the business sector, how to manage their economy loss so that it can be after this COVID they can manage rapidly. They can rapidly maintain their economy, because the economic growth is going to be 0.1% in South in Asia. I think in South Asia it is 3%, or some country maybe 2%, some country maybe 3%. They are going to have that. So this is not after 1960 or 61. This kind of economic crisis is going to happen. That's why this is not a small issue. This is a big issue. That's why now my main concern is how this WASH account we can set up. This should be our role. I can see all our panelists here. They are excellent civil society organizations. They advocate for that for many, many years. I know when we are working in Saxena, we talk a lot about it. Lajana ji, Hasin, all they are one of champions. And Shubhagato, you yourself also one of champion on that. So we have to really find out that and try to work together with the government. Because government, we should not really say that government is not doing this, and we need to bring them on board. Otherwise, how we can solve this? So we need to support them to develop this new investment plan. What they are making, they can still ask for more money for that if they can really plan properly. And here, that's why the biggest challenge here is, I can see that this is the biggest challenge we are facing now is coordination. Coordination is the biggest challenge. Means like the coordination at different level. One is the national level coordination is big gap. At the same time, when you go to the local level, the municipality did not know actually what's going on. Municipal mayor.
Sorry, we are 8 minutes into the session. We have 2 more minutes. We are 8 minutes into the session.
I'm almost done. So municipal government did not know a lot of things, and then how can work together? And at the same time, you can see like the other big challenge is our development partner itself. Because I know like here our colleague, UNICEF colleague there, they are working very hard on this. But UN family itself, they are fragmented. Because of that, sector is fragmented, because UN agencies should really play a good coordination role. That's actually not happening in the country level. Globally, it's going on, but country level is not happening. Maybe in India it's going well, I don't know, but I can give you guarantee that Bangladesh is not going well. Nepal, I don't know, also it's not very well, going well. So that, that we have to have those coordination mechanisms to be in place, and then only then the role of civil society will be much clear, and we, civil society, should work together with this coordination mechanism. UN agencies and government need to lead that. And then UN and civil society should support the mechanism. That is the only way. Then we'll have the uniform BCC message. We can do the RCCE thing. Everything we can do very nicely. Otherwise, it is going to be very, very difficult to manage this big global challenge. So, my friends, I'm very much eager to work with you all. I'm trying my best. Also now, I don't know. Hasin knows how many times I called Bangladesh, try to make things happen, but still not really moving. I know that same thing. I have other, the country also same thing problem there. So thank you so much, Shubhagato. You bring this, the platform, and we really need to really engage quite frequently so that we can really bring this attention to the government as well as big development partner. Thank you.
Thanks so much, Roshan. That was very appropriate way of finishing the sequence of panelists. You raised both the big finance issue and the geopolitics involved, and what as local NGOs or local civil society, how our role translates within that. So holding our own governments to account, as was the case earlier, to track how whether appropriate the expenditures that government does over the next short term results in longer term benefits and is appropriate, and then the effect of that in its implications for the wider sector as a whole. In South Asia, over the last couple of years, there's been so much attention to water and sanitation that we have kind of looked at, means the accountability question on the water and sanitation side was seen to have become quite, was achieved. We thought that's what we were looking to. But as you mentioned, the new programs, all of which means, for example, governments are cash starved on a whole set of new programs. So as we move forward, the national government is going to borrow, but is very targeted in its effort. Is telling most programs to go slow. So we have to make sure that the targeting of the most vulnerable settlements and in the wash sector and the wash infrastructure that goes with it does not get compromised because of the cash crunch in government and how we move forward on that. So thanks for bringing the big picture to our discussion too, Roshan. I'll now request Anju to give us a little bit of a view into all the questions that we have been receiving. Anju, if you could do a little bit of a summary and request which speaker should address what kind of question, I'll leave that to you, and then we can go sequentially across the panel.
Okay, thank you so much. So we don't have too many questions, but what I can do is I can pose specific questions asked to specific panelists first, and then there's certain general thing which any one of you can respond, all the panelists can respond. So let me start with Lajana. The Nepal question to Nepal is that how the role of SFGs and the community-based organizations was in this whole, COVID response, and how do you think they played their role and what kind of roles they can play in the future? And I can also pose one question to Bangladesh, then both of you can respond, then we'll go to other. So the other thing that came to, the other question that came to Bangladesh to Hasin is that how mobile these applications, you were saying mobile applications were installed in informal settlements, how that process was done and how the readiness for the community was ensured, because generally people don't go for mobile applications. So these questions, if you can answer, then we'll move to another round. To other
So, Lajana, you will go first, and then Ma'am Hasin.
Hello.
Yeah, we can hear you.
Yeah, okay. Okay, let me answer these questions. Anyway, thank you for the questions. So the role, the self-help groups, actually the community groups, the community organizations played a very, very important role in supporting the communities, and also in linking the communities with the local governments as well. So they actually help the local governments to identify the most affected families in the communities. There was a lack of data. There's no data actually. So it was a hard time to identify who is the most vulnerable for relief distribution. So when the government came up with the plan of distributing food packets, they are not distributing in a blanket approach, like, you know, the most vulnerable, the most affected, the most poorest families need to be identified. The government had no data, so the groups help to get them identified, and also help to distribute the relief package. And they also worked with the government to set up a local level quarantine centers, and also help to identify the people who have returned from abroad and who need to be tested and who need to be stayed in the quarantine for certain time. So they actually worked with the local government in this. And also, like, because it was a lockdown and the people had difficulty in accessing other health needs. So the community also, the groups also help the people in providing ambulance service, taking them to the hospitals to get the appropriate service. For example, the pregnant women, you know, who had to go to the hospital. So they worked and they supported the women as well. They also shared the information to the wider members of the communities regarding the COVID health aspects, about the the need of frequent hand washings and wearing masks and so many other things, like so the community people, you know, they're not always inside the house, although it's a lockdown. So a few of them are always outside, and they're always discussing and talking about these issues. So they have been linking with the governments, and they actually worked and provided support to the local government to address all these issues. They also reached out the support organizations requesting for help, in addition to what the government has provided. For example, like, you know, water, and also for the disinfectant materials, and so and also more relief packages. So they reached out the support organizations, and they collected the information and provided the information to the support organizations, so actually they can generate some fund and put a proposal. So that kind of role, you know, in the early stage, the SSGs actually played on. There was also another question. I'm just not sure, like, if I can answer to that, right?
No, so it was for you. It was a role of CBOs and SHGs, Lajana. The second question was for Bangladesh, Hasin, that how this application, mobile application, was, you know, taken up by the people. What kind of, you know, reservations they had, and how could you institutionalize this?
Okay, thank you. It's still at the very early stage. At this moment, the mobile phone, smartphone penetration at slum is 30%. So we are encouraging that enrollment of data will be through community volunteers, so that people are enlisting themselves or in their information through the trusted volunteers. So trust building is already there, so they don't hesitate to give their information. So that is one area of comfort. And then another point, there is also a feature that individual can enroll their data. So we are expecting that will come in the second phase gradually, when they will be comfortable and they will be, you know, well known with these features and this application. So that will gradually come. And to popularize this application, we are putting it another another part, which we are calling it knowledge platform. Under that, we are putting several videos which are context specific, so some people will know that what to do and how to manage themselves during quarantine or isolation. So that will feel them a comfort that these are made for themselves. So they will be acquainted with the application and they will feel encouraged to enroll their data themselves. So at this moment, we had a test run of more than 119 people, and we don't find any resistance they are positive about.
Sure.
So let's see what happens next.
Thank you. Okay, so for the next round, there are questions to UNICEF, separately to Shipra and Maria, but I'll just say collectively, you guys can answer. So one question, Mariah, is to you that, you know, this vulnerability mapping and all the kind of researches that you did during this lockdown period and during COVID times in Gujarat, can those be explained better, or in some places, if they are already existing as applications, can people access it, or can there be a dissemination so they know that how this vulnerability exercise was taken? And while now the migrants are returning from the village to the cities, there are issues of their health, again, health protection, safe housing, and making them bargain, you know, with the government. So how UNICEF is seeing that? And the third question, which is targeted to Shipra, is that when we are saying that all these smart urban, like in when Ananda's presentation was mentioned, that smart cities and all that have come up strongly to, you know, deal with this crisis in a better way than other cities. So is UNICEF thinking about developing smart villages where the employments could be generated, so there is less migration in any case to the cities? So these were, like, you know, UNICEF questions. I mean, some questions asked to UNICEF.
Thank you. Let me try and answer the first. The second, I'm not sure if I'm able to answer. But regarding the assessment I spoke to about Ahmedabad, so this was done sometime in May, and I think for me it's a long document. It's 54 pages, and it also includes a response plan. It was a secondary data review analysis. So the fortunate thing, Ahmedabad is a smart city, and all this data was readily available, and therefore it was quite easy to do this analysis. And I think for me the table that stands out is the one that I've shared on the screen. So if we look at the cases are the highest in Central and in South. And if you look in Central, the slum density is actually the highest, even not necessarily the share of the slum population of the city, but the density specifically is the highest in Central areas. And the number of slum settlements also is quite high. It's 150 settlements. And if you look at access to water and sanitation, it's one of the lower access percentages as compared to the other slum areas. So you could see that the caseload is in the location with the highest density and one of the worst access to water and sanitation. So again, this prioritization and analyzing this data is really useful to then target where to intervene and where to respond. I need to check with my, of course, this report has been shared with the municipality, and I need to check with my colleague in Gujarat who is leading this, if we can share it, but otherwise I'm very happy to connect people directly to our office in Gujarat, and they could collaborate further. Regarding the question on the migrants, I think that's a very difficult one, and it goes way beyond our focus on water and sanitation. I do think personally that people, the ones that do return, they would probably end up in very similar situations, and they would not have a lot of negotiation space, and I think things need to be done. I know that the government of India is trying to support more livelihood opportunities in the rural areas for the migrants that have returned to their homes, to their original homes in the rural areas through the Manrega scheme, but that is also a big challenge. So I can't really answer that question. Maybe others on the call could. Thanks.
Thanks. Okay, can I take the general questions, like, to all the panelists now? Can I direct some questions to everybody, because they were not targeted for any person, individual panelists. So 2-3 questions came on septage management, how all these countries, whether Nepal, Sri Lanka, Bangladesh, India, have regulated and prevented illegal dumping of fecal sludge or septage considering it was a health emergency also, and how the campaigns for informal workers, especially the sanitary workers, were conducted to make them aware on various health issues, as well as in use of PPE and other safety measures. These two questions on health. And the other thing which came was that is there any study, if you can say, on WASH during this period, and the collateral damage that has been caused on informal settlements, especially the poor? Yeah, these were the three major things that have come up. So, which is targeted to any one of you to answer.
Should we, anyone wants to take that? Ma'am Hashim?
I can talk about Bangladesh. To be honest, for particularly sanitation worker, government or municipality didn't have any particular arrangement or training for them, or neither they had arrangement for any safety gears. But INGOs, NGOs who are working with them, they actually supported them with specific training and safety gear, and supported them, especially in COVID context. Another information I can give you, very recently we had undertook a study on them. I mean, this actors, sector actors who are working with them, they had undertook a study, and we found that initially there is a drop in business and demand. I mean, demand in this pickle sludge management, and later it enhanced, and people started, and this became a normal part of our life right now, and they resumed their work, and now they are starting applying their safety gears and on, and they are aware of the COVID messages because of the mostly of the media and the NGO effort. That's all.
Anindita or Shipra, you want to talk about Odisha or what the alliance members have been doing?
Thank you, Shubhagato. I think Odisha has also taken out a lot of advisories for FSM workers in different parts, because as there are a lot of FSM plants in Odisha, and also for the sanitary workers who are in the front line, in the sense, WASH frontline workers. And what we see is probably advisories are there, certain capacity building measures and constant monitoring is also there. But what is important, it is more of a behavior change issue, and it is important. So even if you are capacitated, or if you have the information, the knowledge that these are essential, because they are into a very hardcore physical activity work, at times you'll see the mask not on their actual place, but it comes down into the neck. So even if PPs are there, how much they are washing and how much they are recycling and using it, or how much to more of a behavior change issue. That's what I see. But otherwise, systems and advisories are in place, and capacities have been done. As I said in my presentation, a lot of capacity building things through we are providing them, and we have built in the capacities of the master trainers also in Odisha.
Thanks. Thanks, Shipra. I'll just take 2 minutes. So many of our NFSSM partners have been working very closely with the state and city governments. And during the lockdown, is only the essential services out. So as Hasin was also saying, so people could not access mechanized services, and the governments realized that faster with support of agencies, and they have actually moved out to consider these services as essential, and hence the applying was free. They were issued ID cards in Maharashtra, Telangana, and Tamil Nadu, where they could actually continue their services through mechanized desludging that could have prevented a more integral manual desludging at the need of the hour. And since we are coming up with many FSTPs and the dumping is still going on irregularly, I don't think on that side we could do much unless there was FSTPs in those cities and towns.
Right, thanks, Anandita. if there's Pranab Paranghe. Do you want to come in? Your hand is still raised. We can unmuting you now in case you want to make a point. You can unmute yourself and come in.
Yeah.
Not really. It's talking is permitted, but Pranab, if you want to come in, or should we'll move on?
I think it will be some connection problem at his end. It's not
all right. Means thank you. Means I think that's much of the question answer. I wanted to give.
Shubhagato, can I just come in 1 second? There was one question which was asked on the village smart cities, a village plan was also asked. So I just wanted to tell you that a village preparedness plan was also developed and tried out in Maharashtra, and later it was in consultation with the Panchayati Raj, national level Panchayati Raj department. It was later shared with all the states, and even including Odisha, we have been able to test that and scale it up to all the villages. So a preparedness plan is in place. All the sarpanchs have been trained, so which is helping them to more prepare themselves for the COVID. And as I said in my presentation, with CPR, we are also trying to do a assessment of these slums and create a database, as well as prepare the COVID response plan. So probably in next 5 to 6 months, we will be out with a more detailed tools which will be able to help people prepare themselves much better in the slums level. Thank you.
Thanks, Shipra. Yes, means.
Can we come in for a minute?
Yeah, I just wanted to do a round of one last minute before we close. We can start with you, Lajana.
Okay, thank you. Okay, regarding this, I have just 2 points to make. Regarding this health and safety of the sanitation workers, I just want to share what is happening in Nepal. Actually, these sanitation workers engaged in the informal sector, they are more vulnerable. So the sanitation workers employed by the municipalities, they have access to certain benefits, although they are not fully covered. They don't have access to all the facilities, but still they are much more in a better of condition compared to the workers in the informal sector. So I think the sanitation workers sanitation workers employed by the municipalities, they also have insurance, so they are also insurance, whereas the informal sector sanitation workers, they are not covered by any insurance scheme. So that is their biggest issue, and they have been highlighting and raising this issue, right? And another point is, we have heard a lot of talk that the cases seem to be concentrated in a highly urbanized centers. That's what we have heard in this discussion. But here in Nepal, actually, the most highly urbanized city is Kathmandu. But we have more cases in the other districts, where actually, where the areas, the cities that actually borders with India, because we have a large number of migrants coming back to Nepal and coming to their villages, these are the cases, positive cases coming, and so the number of cases started rising in Kathmandu much later. So still, compared to the other districts, Kathmandu has fewer cases. So I just wanted to highlight this. It's not only in the urban, but then how the infection is happening in other areas. And the last point is, I would like to thank actually Roshanji, because he has actually raised a very, very important, pertinent issue that we all have to think about it, and we really have to truly work on that issue. But then, because now we have here UNICEF, WaterAid, and other donor organizations present here, so I just wanted to highlight this in relation to what Roshanji has just shared. This advocacy at a higher level, at the national or even at the international level, advocacy at a higher level, at the macro level, is not to be done only by one civil society organization. It is not even possible. So the donors need to support in strengthening the networks of the organizations. in the network of the organizations, or even to build a strong multi-sector, organizations, like even research institution can be a part of that. We can actually give all these data and so, but then it has to be a network. So they need to think and start supporting in strengthening the network of the organizations and raising all these voices, right? So that is very important. So, or only, working with only one single partner and one single organization raising the issue, that will not actually bring any result. So I hope and I also request UNICEF, WaterAid, and also other donors to start thinking and then to support in strengthening the network of the organizations. Thank you.
Thank you. That's a wonderful point, Lajana. Can I ask you, Ananda, to come in? Means it's more or less last comments, but if you can respond to the other presentations and speakers that you heard and reflect on it. 1 minute, Ananda.
Yeah, in fact, those presentations are very informative, and it highlights the gravity of the situation in most of the countries. Actually, we are, of course, nowhere near to these real national issues. In terms of septage management, I just want to touch that we are now we are planning our wash sector to achieve SDG 6.2, that is to achieve safely managed sanitation. So on-site sanitation, wherever there are issues, we build septage treatment plants, carry the overflowing septic tanks to the nearby septic tanks, so that septage treatment plants to treat and for this safe disposal. That is accepted as a national policy, and every year at least 5 plants are being added to the operation. Yeah.
Thank you. Thank you, Ananda.
Yeah, thank you very much for organizing this, and this is an excellent way of going. The way we must think of way forward, and also continue to do this periodically until we come out of this situation.
Yeah, thank you, Ananda. Ms. Hasin, would you come in for your last minute of reflections?
In fact, I would like to thank for organizing this event, and Lajana is rightly mentioned our last point about joint advocacy at higher level. And I believe that not only it is not the role of only the civil society organizations, but also the role of donor agencies. They should also fund, and they should also be supportive to the civil society organizations and networks to come forward, come together, and come up with, to make hold the government accountable for this agenda, that where the fund is going. And especially when we are talking about COVID, we are observing in every single country that most importance is given to the health sector and curative support. Not everybody is thinking of preventive measures. So wash is an important factor, and hygiene being the first line of defense, nobody is caring for wash. So we should think that how fund is diverted to wash, and everybody should be proactive in support of that. So that's my last point. Thank you.
Thank you very much. May I request Neha and Anindita? Neha, you wanted to come in?
Yes, sure. So I have a couple of concluding remarks that I quickly want to share. As the disease, as the pandemic spreads to less urbanizing districts and smaller towns, and given their significant slum populations and limitations in resources and capacities, it is very important to take preemptive action. And Roshan also pointed out the need to coordinate with governments when it comes to this, and the national government has been doing a lot in putting out these guidelines and advisories. But what is needed is some way for these to be enforceable, and for some way to be able to monitor what the states and ULBs are doing. And the second thing is just the need to have some disaggregated data, and this is something that's come up across all of the panelists we've heard. Right now we get the numbers at a state level. So if we can actually break down those numbers a little bit, not just to diagnose, but also to help strategize around what these investments and strategies need to be, I think that'll be very useful. So those are my 2 remarks. Thanks so much.
Thank you. Anindita?
Yeah, one line I'll borrow from Lajana is that, the slum interventions has remained as a patchwork through and through across South Asia, I guess. And unless we streamline those patches within the overarching narrative of intervention, we'll keep debating this. And pandemic, no pandemic, unless we create a resilient strategy for informal settlements, which is in sync with the overall city, we'll not be able to achieve the outcomes. Thank you.
Right. Roshan, can I request you to come in on various issues that you want to address as your closing remarks?
Yeah, thank you so much, Shubhagato. Couple of things. Number one is still this sector is now still the Ministry of Health. So how can we bring out from Ministry of Health to make them realize that this is also part of the Ministry of Water, Ministry of Sanitation, Ministry of Urban Development, Ministry of Social Welfare? How can we make realize that? That is one of the big important point that we need to work it out. Otherwise, the money is everything going to Ministry of Health, and they will spend all the money only for the hospital building. So that we need to be very careful. Number one, this. And number two, to do this, we need to have a strong coordination mechanism. We, as a civil society, let's consider us, I'm also one civil society, okay? So, as being a civil society, we need to be strong. So I'm very happy that here we have all these 3-4 strong champions are here. So I'm very much happy to join in your movement as a deputy director of the foundation. Also, we are very happy to do that kind of advocacy, working with you. That this is my commitment. You first initiate that kind of mechanism. We'll be working with you. Because this is also, we also do the support for the WAS advocacy. Means this is also kind of WAS advocacy. We just need to design such a way that how the WAS account also will be considered in COVID response program. And we need to be constructive, not destructive. We should not really blame government. We should not blame to the development partner, development bank. We should be very much suggestive, constructive, and they will listen. And number 3 is about we really need to do monitoring. We need to strengthen our monitoring mechanism. That's also part of the civil society movement. For example, in South Africa, they developed very good monitoring mechanism, how to monitor the slum sanitation WAS component in the slum. And that data is really helping them to improve the situation. And municipality and the urban city is very much supportive on that. And that they are collecting that data from the civil society and they are helping that. So how can we develop that monitoring mechanism of the informal settlement so that they can have access of that services, and then that report will go to the concerned ministry, concerned city authority, and so on. So that's why I fully agree with Lajana ji. What you also said that it should not be patchwork. Definitely, it should not be patchwork. It should be concrete, very big program, and it's possible only if we really plan together. Thank you so much, Shubhagato, and thank you so much for all the panelists. It's really great time you did. So let's work together.
Yeah, Roshan, Marije is the last one. I mean, no one's going to have a last word today because I think we are going to get a few more of these in, and this is going to change. The situation is evolving. So, means as a community, we plan to be in touch through this medium. But Marije, if you could come in with your one minute on how this multi-scalar means, what has been your what has been your initial learnings on coordination and multi-scalar operation that you have been involved in so far? What have you seen as the constraints and positive aspects of it? And your last minute. That was my request to you, but you're open to use your last minute the way you feel like.
No, that's excellent. That's actually what I wanted to talk about. I think, like I mentioned before, and others have mentioned as well, this is a disease that we don't know much about yet, and we continue to learn every day, and information continues to come in. At the same time, we should not wait until we know everything. We need to act now, and we need to continue the coordination and the sharing of this information. Even if we don't have a lot of resources, there is so much that we can do. And especially in India, where we heard there's a lot of funding available, existing funding available with the government, with the banks. We're discussing with the World Bank, we're discussing with the Asian Development Bank, and with other banks. So we are coordinating and facilitating these discussions because we want everyone to be aware where are the issues, where are the priorities. And just as an example, we had organized an exchange between Mumbai Corporation and Delhi Municipal Corporation, sharing the experience of operation of community toilets, just so that they could understand each other's experience and learn from each other. And even we don't have a program in Delhi, but others do. So we connect the officials so that they can also learn. And it's really putting government in the lead and supporting them with the right information and with hand-holding support to ensure that whatever is guided is also actually implemented and people are held accountable. And lastly, I think this crisis has really given us a great opportunity that everyone, all of a sudden embraces hand washing with soap. We should really, really focus on trying to sustain this momentum. I think this is very important. It's not just COVID-19. Generally, it's a really good way to prevent any disease. So I would suggest let us continue also, once COVID is over, let us continue investing in emotion, especially in behavior and hand washing. Thank you.
Thank you very much. Thanks to all the panelists, especially Roshan, for being with us late into the evening at his end. I think the way we are looking at this, and I guess everyone around the table, is that we evolve as we move forward, as Marije just placed it, and the challenges that everyone mentioned and how we progress on it, how we can make the response more robust, in the sense that yes, this was the first 3-6 months where we were hit hard by it, but how do we recover, get back to the economy, get back doing our things with the added measures in place, refocus from health infrastructure alone to public health more generally, and look at the how we evolve this space. Hopefully there will be an end in sights at some time. As of now, we aren't yet there, but till we meet again, I want to thank you all, each one individually, for your time, interest, and the great work you're doing. We'll be watching the space and putting in what we do as op-eds and research papers as we go forward. But we'll be happy to work in networks to allow for cross-exchange of learnings. So thank you again for supporting this event, and look forward to connecting soon. Thank you, everybody. We'll close it for today, but hope to connect soon again. Thank you. Bye-bye.
Thank you very much.
Thanks.
Goodbye.
Bye.
Thank you. Bye.
Bye, Roshan. Bye. Bye, Lajana.